Good afternoon, everyone. My name is Leonard Samariba. I'm a doctor of physical therapy and co-CEO of ProFysio Physical Therapy. Since 2013, ProFysio Physical Therapy has been providing clinical excellence and unmatched customer service to our patients that have musculoskeletal and neuromuscular problems to provide an optimal rehabilitation outcome and experience for them. Today, it's my pleasure to present to you our second installment of our Zoom at Noon series. Today, our esteemed associate, Dr. Nichole Chaviano, will be presenting on solutions for improving balance and preventing falls. Just a few household items before we get started. We want to make you aware that we will save plenty of time to answer questions for the presentation. If you have a question, please click on the Q&A button at the bottom of your Zoom screen and submit your question. We do ask that you submit your question anonymously to protect everyone's privacy. And of course, full disclosure, we want to make you aware that we are recording this presentation. We'll be posting it on our social media and our YouTube page and other media outlets such as those. So without further ado, I'd like to present you to our Doctor of Physical Therapy, Nichole Chaviano, and Director of Clinical Operations of our East Brunswick location.
Hello, everybody. Good afternoon. I'm going to be sharing the presentation with you. And just like Dr. Lenny mentioned, we will have plenty of time for questions at the end. So please type them in now so you don't forget as they come along. And then from there, we'll be able to get to them all towards the end of the presentation. All right, so we'll get started. And just so everybody's aware, our objective with these seminars is really just to provide education to our community members as well as you and your families, to provide you with some information that can help you to improve your quality of life, make sure you're not having any issues at home, especially now that we're spending so much time there. So we're going to talk a little bit about understanding why we fall, how to prevent it, and strategies to move forward to make sure there are no injuries. So just a little bit about me. I am a doctor of physical therapy. I am the clinic director of our East Brunswick location, but I've had the pleasure of working in all of our 5 offices. So I'm really familiar with all of the clinics as well as all of our staff members and everybody that's going to take great care of you. So I do have a bachelor's degree from the University of Delaware in physiology, strength and conditioning, exercise science, and a doctor of physical therapy from Rutgers University. I have a concussion certification, and I'm working towards a full manual therapy certification through Maitland seminars, which I've been doing for a number of years. So spending a lot of time doing that. Lots of experience with treating orthopedic conditions, as well as focusing on the manual therapy techniques, progressing therapeutic exercise. I have a large background in that. And really, you know, our goal as a company and the reason I chose to be a part of the team is because, you know, we're able to provide personalized care for all of our patients, make sure that we're, you know, achieving your personal goals, not our goals as clinicians, and making sure that we're getting you back to the way you want to live your life and get back to things that you love to do. So we're going to jump straight into defining falls. So falls are events that lead to unplanned or unexpected contact with a lower supporting surface. So that might be a chair, the ground, a piece of furniture, stairs, etc. Now, near falls are very similar, but you don't actually land. So a stumble or a loss of balance that would result in a fall if you didn't have the ability to catch yourself. So that would be catching yourself on a piece of furniture or a railing or even a wall. And, you know, as we age, these become more and more common, more and more frequent. It happens when there's a lot of clutter or there's a lot going on. It happens in unfamiliar environments often as well. So the incidence, like I mentioned, is really high. So 1 in 4 older adults fall every year, but only half tell their doctors that they do that. Some of it is embarrassment. Some of it is fear that they're going to have their privileges taken away. And it's really important that through full disclosure, you're letting your doctors, your therapists, your family members know exactly what's going on so that if there is something that can be done, changing medication, seeking therapy, or even having some balance training to help reduce those falls can happen. Every time you fall, it doubles your chances of falling again. And unfortunately, falling is the #1 cause of injury and deaths from an injury among older adults, because a lot of falls do result in injuries that are more significant than a child or a younger adult would be. So it's really important that we get ahead of this and make sure that it's not something that is happening as consistently or as frequently as it might be happening now. Now, 1 in 5 falls actually causes those serious injuries that we were talking about, broken bones, head injuries. The others don't necessarily result in those, but if you're having more than one fall at a time or one fall in an instance or even over the course of a year, the likelihood of it happening is pretty significant. More than 95% of hip fractures are caused by falling, and that's usually falling sideways. It's not falling onto something. So this happens getting in and out of bed, or if there's an object on the floor that you land on. Your instinct is not to land forward, it's to kind of come sideways to protect your head and face. Now, head injuries can be very serious, especially if you're taking any medications like blood thinners. Older adults who fall and hit their head should see their doctor right away, even if you don't believe you have an injury, just to make sure that everything is where it's supposed to be. And now falls are considered the most common cause of traumatic brain injuries. And brain injuries, especially in the older population, can lead to long-term disability or damage, as well as lead to increased falls because now we've altered the brain structure. So many people, if they fall, even if you fall and you don't become injured, a lot of times you become afraid of falling. And unfortunately, that fear of falling causes a person to cut down on your everyday activities. You become weaker, you become a little bit less agile, a little bit less balanced. It becomes this very poor cycle of just continually falling because the system is weakened, or you're concerned about falling, and that's the #1 predictor of falls, is that fear of falling. So that fear of falling that we mentioned, about 50% of older adults have that fear of falling after just one fall, and 25% admit to limiting their activities due to that fear. So it's a good amount of folks, and it's a high number, and it is concerning because the less you do, the more likely you are to have injury, isolation issues, all of the above. So it leads to functional decline if you're self-limiting yourself, if you're not out and about in the community. It also leads to other psychological complaints, depression, anxiety. Falling is not normal. It doesn't have to be normal, although most people say, oh, it's normal for me. I just have gotten older as I've gotten older. Most people have the ability and the capability to reduce their fall risk by getting stronger and by practicing the things that they need to do in order to reduce their fall risk. So we're going to talk a little bit about the balance system and understanding how your balance works. So many of the systems work together to maintain your stability of your body and your vision. So good balance is dependent on the information from several systems, and that includes your brain, your physical touch, as well as response from your muscles. And we'll get deeper into that a little bit. So the big 3 are going to be your visual system, so physically seeing it, your somatosensory system, so actually being able to feel the ground underneath you or feel tactilely where you're at. And then the vestibular system, which is that inner ear, which again, with aging does diminish. So your vision provides information to your brain about your environment. So you can see the difference when you're wearing your glasses versus not wearing your glasses, if there's low versus high light, if you're in your home where you're very familiar with your surroundings versus somewhere else that could be a little bit more distracting, a grocery store where there's a lot of lights and sounds and visually stimulating where there's different colors and boxes and all of that is definitely different than when you're in a safe, quiet environment. And so the other thing that your vision system tells you is where your body is in relation to the horizon. So when that happens when you're sitting still or while you're moving, and so your visual system is really responsible for making sure that you can understand where your body and your brain is in space. It is appropriate that you continue to wear your visual aids, even if you're just getting up to use the bathroom, or even if you're in an environment that you're comfortable with, because there can always be unforeseen things in the area that could affect your vision system. This is a really simple way to reduce your fall risk, is to use the visual aids, contacts, glasses, etc., that your doctor has prescribed to you in the correct prescription. So making sure that you're seeing your doctor frequently and you're updating those prescriptions. Now your somatosensory system is the special sensors that respond to stretch, pressure, vibration, or touch, and that happens in all of the parts of your body, your muscles, your tendons, your joints, and your skin. And it helps your brain to know how your body's positioned and how quickly you're moving. So when your foot hits the ground, there's a sensor that goes from the ground through the skin, the muscles, the joints, up to your brain to say, I'm moving at 1 mile an hour, 2 mile an hour. This is what the ground feels like. It's uneven, it's unsteady, or I'm on stable ground and I'm moving slowly. Now, if you suffer from any condition such as a neuropathy or any loss of sensation from injuries or illness, it could be injuries to your lumbar spine, it could be injuries to your lower extremity, or it could just be loss of sensation over the years, it can decrease the sensitivity of these sensors, and it can affect the way that your brain and your body relay the message about where you are. And then finally, your vestibular system. So the vestibular system is hard to understand because it's very tiny, it's in your inner ear, and it's, there's a lot of moving parts that affect your balance. And so essentially what it is a tiny organ in your inner ear that tells your brain about your head position and movements. So there are different canals that tell your brain and your body, okay, I'm moving up an elevator, or I'm going in a straight line forward, or my head is tilted now, that's why the visual system is affected and I'm not looking straight ahead at anything. But any conditions such as BPPV, which is a positional vertigo, as well as inner ear infections, sinus infections, any of the viruses, as well as any long-term damage from noise damage, those types of things can affect the vestibular system. And so this is something that we treat permanently if there is just a specific vestibular system issue, or if it's something that we have to learn to compensate because it's just long-term damage and it's not going to be able to come back. So you've probably had friends say they have vertigo or they get dizzy, and a lot of times these are treatable conditions of the vestibular system, but it's just not something that everybody's aware that can be treated. It's just something that everybody lives with. So making sure that you understand, is this a condition that we can treat independently and then work on the balance to make sure that there aren't any falls or loss of balance? Or is this something that we have to treat with compensation and understanding how to work around having that deficit? And then your brain, of course, has a role. So your brain is involved in everything your body does. And like I said, those senses travel to the brainstem, and then the brain gets the information from the other parts of the brain, such as previous experiences. Like I said, if you've had a fall, your brain is immediately going to say, oh, I'm going to fall again. So reducing that fall risk or reducing those instances helps reduce the brain's capacity and its desire to feel like it's going to have that experience. And so then it also takes information from a particular situation. So if you're in the dark, it's going to heighten your other senses and take away part of the visual system. If you're on an uneven surface and you're getting variable feedback from your somatosensory system, it's going to heighten your visual or your vestibular system to help you understand where you are in space. So it's just going to heighten the others to try to reduce the need for that one of the three systems. But the problem is if you already have a limited vestibular system, or you already have a limited visual system, and now you lose a second or a third because it's dark or uneven, or you're on a really fast elevator or roller coaster, then we're going to affect the way that the others can chime in and help out. So there are a lot of fall risk factors, and we're going to go through a good amount of them. So what are the conditions that make you more likely to fall? Again, history of previous falls, any lower body weakness, vitamin D deficiency, already existing difficulties with walking or balance. Certain medications can affect it, any vision problems, any problems with skin or sensation, a recent hospitalization, becoming fatigued easily, getting dizzy when you stand up from sitting or laying down, any blood pressure changes, inappropriate use of a cane, a walker, or any assistive device that has been recommended to you, any foot pain or poor footwear, and then home hazards and dangers. Now, most falls are not caused in isolation. It's usually a combination. If you've already had a fall and then all of a sudden you aren't wearing your glasses, the likelihood increases. If you start taking a new medication which reduces your blood pressure and now you're getting dizzy, that is something that can be a kind of combination of effects. So making sure that you are speaking with your doctor if you're taking any tranquilizers, sedatives, antidepressants, any blood pressure medications, and relaying the information of I'm getting dizzy when I'm doing these things, or I've had a little bit more of those losses of balance where I'm running into walls, or I'm catching myself on objects, or I need to use a walker when I was using a cane just 3 weeks ago. Is it possible that it's caused by the medication? Or do I need a new glasses prescription? What are the causes of that? And if none of those things are the answer, then perhaps it is something like lower body weakness or limited sensation. But if you're not testing and you're not appropriately diagnosing those things, you can't treat it to then reduce the fall risk, to then reduce the likelihood that you're going to fall. So how do we as physical therapists help you improve your balance? If you've never had physical therapy before, it's not as scary as folks think. It's really, we work together to create plans of care for our patients to make sure your goals become our goals. So we want to be able to get you walking, spending time with your kids and grandkids and family members without having any limitation because of they have stairs, or because they have, kids running around all the time under your foot and you're losing your balance. So being conscious of those types of things. So, like I mentioned, with physical therapy, we focus on all of those systems. We treat from the top down. So we're really skilled in understanding, is this a vestibular issue? Can I treat that in isolation and reduce the dizziness or positional issues that are happening? Is it a weakness? Then we're going to check the strength of all of the muscles of the lower extremity. We're going to assess the balance. We're going to understand, is it a gait issue? Is it a walking issue? Is it a weakness? Is it a sensation issue? And, how are we dealing with that? And what are the options for recovery from some of those issues? Are you becoming fatigued? We may need to talk about an endurance-based program, because the more tired you are, the more likely you are to fall. Most falls happen in the evening, the middle of the night, when you're a little bit groggy, a little bit unsure. And then we add in the loss of the light, or, not taking the medications, or coming from a laying to sitting or standing position, all of those combination of risk factors. Are you using your assistive device properly? So that is something that we deal with every day, is fitting and making sure that your walker is the right height, you have the proper handles, or the cane is correctly used, your sequencing is correct. Are you getting around the clinic with ease on a nice empty ground? Okay, well, we may need to go outside onto some grass or uneven surfaces to make sure that's the problem. Getting in and out of cars is somehow sometimes an issue where patients can't get into a higher car. So, we may say, okay, we have an SUV, let's try to get in and out of it so that we reduce the fall risk, so that if you are spending time with your kids or your grandkids and they want to put you in their truck, you have an easier time doing that. Are you having any musculoskeletal pain that could be causing some of the issue? So any surgeries or any arthritic conditions, anything that could cause some musculoskeletal pain in your back, your hips, your knees, ankles, feet, or even the upper body. If you can't, you have an arm condition and you're supposed to be using a cane, so now you're not using the cane, how do we reduce those injuries or pain so that you're able to do more easily? Again, we could treat certain types of dizziness if they are caused by those vestibular conditions that are treatable. And then discuss those fears of falling. Why are you afraid? What has happened in the past? What is the experience? And how do we retrain your brain to say, this isn't what it's always going to be, and this is not how it's always going to happen every single time. So we're going to, when you come in, or if you come in or see a different therapist, you're going to review your medical history. We're going to talk about the home safety. So are there things around your house that are a fall risk? And we'll go through some examples of those. We're going to check heart rate, blood pressure, at rest, with position changes, and with exercise. If we're finding that every time you go from a laying to sitting position, is it a positional vertigo issue, or is it a blood pressure issue? Is it a medication that's causing a blood pressure issue, or is it that you run low and that's what happens? And what are the strategies to help reduce the falling in those positions? We do foot and footwear assessments. That might be checking sensation, wear pattern, gait pattern, again, using assistive devices appropriately. And then again, checking your balance, strength, and walking ability. So it's a top to bottom approach when we're talking about balance and fall prevention. And then our treatment is going to be based on your evaluation. So it's not a one size fits all, and it's not cookie cuttered. We're going to design a plan that is tailored to your needs and your goals. So it may be balance training. So it's been shown to be an important and effective part of fall prevention. And your PT will design exercises that challenge your ability to keep your balance, but then also help you recover from any loss of balance. Maybe gait training, so working on your walking pattern, using your assistive device appropriately, or if not needed, to get rid of that because it might be a barrier. It also might be, your goal might be to go from using a walker to using a cane. It's just an easier thing to manage for you. And if that's something that we deem appropriate, we may start working into that. And then negotiating obstacles, walking on different surfaces safely, and all of those walking tasks. Dual task training. So this is huge for fall prevention, is making sure that not only are we improving your walking while just walking, we're improving your walking while doing another task. So this tends to be when people fall the most, is when they're carrying something, or they're, moving from one task to the other, or doing two tasks at once. And so we want to increase your safety doing those tasks, but that allows you to improve your quality of life. It's not, I have to get up and walk to this part, then I can finish what I'm doing. You can continue to have that conversation. You can carry things. You can do different mental tasks as well. And then strength training, it is a key element in all of fall prevention, and it's very effective in preventing falls, especially when it's combined with those balance exercises. So we'll figure out where your strength deficits are, and then we focus on those specific muscle groups to make sure that you improve your standing balance, your balance while walking, and then your recovery from loss of balance. The stronger you are, the easier it is to reduce your fall risk, because one, you're not going to fall as often, but two, even if you stumble, you're going to have the ability to recover from those falls. And then of course, address any orthopedic issues. So most folks think, okay, I can only go to therapy if I have pain. Well, that's not necessarily true. If you're having any functional limitation or any issue with your day-to-day life, it's probably something that we can treat under the umbrella of physical therapy. Some additional types of training are going to be that endurance training. So making sure that your aerobic exercise is relatively low but long duration. You're able to do things for longer periods of time. So again, you're not just able to get from point A to point B and then need to take a rest. You're able to do a little bit more than that. Aerobic training can actually improve almost every aspect of your health, and it may even help for weight loss, weight management, and some recreational activities that you may be interested in participating with. Again, pain management, if you are having pain, it's something that we treat every day. Reducing that pain is going to reduce the amount of issue with getting in certain positions, staying in certain positions, and therefore reduce your fall risk. Fear management. So this is a little tricky, and most folks don't think this is something we have to manage, but it absolutely is. We want to understand where your fall risk is, understand why you have fear, and then treat it from there. So your therapist is going to help to build your confidence and help you get back to some of the activities that you have been avoiding because you're afraid of falling. So your assessment has to be as honest as possible. If we know where the concerns are, then we can help to treat them and help you become confident in those situations. And then any education and personal recommendations. Your PT will spend time trying to explain to you how to best manage your own fall risk. They may also talk to you about the best activities to maintain your quality of life or improve it, and offer any educational resources. So recommendations will be made based on your condition, your goals, and the goals of your family and spouses. So we're going to go through some common home hazards. Everybody has seen something like this happen where you have a rug on the ground and it's not secured, or it's just a throw rug and it's not very stable. But we're going to go through more specific examples. So the issue really is that we move about our homes not realizing any of the dangers that we have out there. A lot of the time, if you're thinking about something, if you're on a phone call, or if you're not paying attention for any reason, you might think you know your home so well that you can just do it. Being in the dark is an issue, but also trusting that you know where everything is. Now, we run into trouble where folks have their kids or their grandkids or whatever's going on over, and they leave toys out, or they leave different things, or they move furniture for guests, and now you forget that it's there, or you're a little bit dazed because it's the middle of the night and now there's something on the ground that you weren't expecting. So being aware of all of your surroundings and having the visual capability to assess that. So we have some flashcards, and this is from Phillips that helps with, we're gonna go through a typical home room by room, and then we're gonna identify the hazards and discuss how to improve your home to keep you safe. So what's wrong with this room is there's a cluttered nightstand, so you're not able to see what's going on. There are lots of objects on the floor, so that rug, those socks, and then the phone is also not accessible. It is kind of behind the nightstand, and it's not really in a place where somebody, if you did fall or if you needed help quickly, could get to. And then awkward furniture arrangement. If you've been in your home for a long time, we all accumulate a lot of stuff, and unfortunately stuff takes up space. So if you're spending a lot of your day kind of scooting around furniture or scooting around objects, it might be time to either move them or pare them down a little bit just to give yourself a little bit of that reduction in the room. So the way that that's going to look is going to be like this, having a clear floor, the shoes are tucked away, not something you can stand on and slip, the rug is gone, and then also your phone is within reach if there is an emergency or if you need something. The next room we're going to go through is the kitchen. So many of us have these kitchen mats in the on the ground in front of the sink. Using something that has a non-skid, or making sure that you have a non-skid underneath it to make sure that it's not something you're going to fall over, as well as any pet dishes that are on the ground. They should be out of the way and in an area where you're not going to hit them or run over them. And then making sure that you also have your most utilized home items. So your everyday plates, your everyday glasses or mugs, your everyday spices on a nice level surface where you can reach them, rather than on a very high shelf or a high cabinet where you cannot reach them, or you have to get onto something to climb onto. So again, moving those plates down, moving those glasses down, keeping your medication at a level height where you can get to it, removing the rugs, or again, if you want to keep the kitchen rugs, understandably for mess or cleanup, you make sure you secure them down with either having a non-skid underneath that you've attached, or purchasing a non-skid rug that has that silicone on the bottom. And then again, moving those pet dishes out of the way to reduce the foot traffic. And then the living room. So most living rooms look like this, where we have, again, those non-secured rugs. If you're following the theme here, those non-secured rugs tend to be the first thing that everybody trips on. Even those folks that don't have balance issues can attest that they've tripped a time or two on a rug that was folded up, if you have a pet that's kind of messed with it, or even if you just misstep and you kind of hit the corner a little funny. So unsecured rugs should not be in any room of your house for all ages. Exposed cords, these are very dangerous, because not only can you have the ability to get caught in them, whatever they're attached to can fall down and injure you in addition to the fall. So being sure that everything is neatly tucked away. Most things come wireless now, so if you have the ability to make things wireless or have wireless phones, and making sure that you do have a phone handy in each location, that's something that you can get to if there is any injury that happens, is important. So either having a life alert, your cell phone, or a home phone in the room. And then having clutter. So pillows, throw rugs, knitting baskets, toys for the kids and grandkids, plants, anything that really is around the area where you would most spend your time, or any walkways that you're most commonly using. Those are the things that we want to try to clean up. All right, so that is the end of our formal presentation. I do want to give you some suggestions as far as balance and fall prevention within the clinic. So you want to make sure that you understand where you are at all times, understand that you're using your lights at home, and that you're making sure that you're cleaning your home appropriately to reduce clutter. If you do have concerns about balance, it's always something that we can discuss at this point, or if you have questions, but it's definitely something that we can discuss in either in-person or video consultation. So we are utilizing a telehealth service. It works pretty similar to this, where we set up a Zoom and you can kind of show us the environment, you can walk us around, and we can do some basic balance tests or assessments, as well as bring you into the clinic and having those discussions. It could be something that we do for you. And we always offer complimentary both in-person and video consultations. So if you're not sure if you are a candidate for physical therapy, it's definitely something to address or at least ask some questions about. We have 5 locations throughout Middlesex and Monmouth County. Like I said, I'm in East Brunswick, but I've had the ability to work with most of our colleagues in all of our other offices, and everybody's really fantastic at dealing with not only those musculoskeletal conditions, not only those vestibular, but also those balance conditions. So it's definitely something that we can work with you if you have questions. We do offer some complimentary transportation depending on location, and you don't need a prescription. So it's not something that you have to get into the doctor to get a prescription just to come to therapy. We can see you direct access, and then you can either ask all of your questions and we can do a consultation, we can set up evaluations or whatever might be most appropriate for you. All right, so we're gonna take some time to go through your questions. Okay, so we had a question about the balance training. So we want to think about the balance training is going to be focused on what we see in the evaluation. So it may be that there's a strength issue, or it may be that when your base of support has changed, that's when your balance changes. So having your feet close together might be affecting it. Having your feet in like a tandem, one foot in front of the other position might be challenging for you. It may be that your static balance, so standing straight, is really where you become very wobbly versus walking or moving, and that might be where your limitations are. So understanding those different things. So if you want to utilize the Q&A feature, if anybody else has any questions or comments or concerns at this point, you can just let us know, and we'll wait a few moments just for questions to come in.
Nichole, I thought it was a great presentation. Thank you so much. I really appreciate it. I had a quick question. What would you say is a so a typical length of care or plan of care for someone that is having issues, maybe a bit deconditioned, has noticed that their balance is not quite what it used to be, but maybe they haven't exactly had a fall, or anything like that, but they're not feeling like their balance is as good as it once was. Could you talk a little bit about what the length of care, the plan of care might look like, maybe a little bit of what the assessment might look like as well?
Yeah, sure. So, the length of care is going to be dependent on just those factors exactly. So what is your endurance like? What is the strength like? Taking time to work on strength, it does take a little bit longer than if it's more of a stability issue. If you've had some loss of balance, or if your balance just isn't 100%, generally these are types of conditions that we can get back up and running with good practice, both in the clinic and in-home exercises that we're giving you over the course of a few weeks to a shorter, less than 3 months. Some conditions take longer if there's a lot of medical conditions, or if there's multifactorial, if you have, surgical status, or if you have any issues with musculoskeletal conditions or pain conditions. Those are things that can lengthen or shorten the amount of time that you're here. And then the assessment is going to be thoroughly comprehensive. We're going to get your whole past medical history, a list of your medications, so that it's something that we can understand could or could not be a factor, all the way down to physically taking measurements of range of motion, sensation, checking the different types of sensation, going through formal balance assessments. So there are national standards of balance assessments that we can then make decisions about where your fall risk is, and then how are we objectively measuring if you're getting better. So that's part of where we're going to look for your balance assessment. And then we're going to check again your strength and make sure we understand where your endurance levels are.
Wonderful.
Good.
Thanks, Paul. I appreciate it.
Sure. And so we do have a couple of questions.
Yes.
Yep. So we do have a question about what's on everybody's mind is what precautions are put in place for a person having therapy in our facility, considering COVID and all of the restrictions at this point. So we've made a number of changes to the way that our clinics are run. We're limiting the amount of people in the clinic. We're doing safety checks on every single patient with a questionnaire that is CDC, from the CDC. Have you traveled? Asking questions about symptoms every single time the patients are coming to the office. We're doing temperature checks. Everybody is required, both the therapists and the patients are required to wear masks. Some wear gloves. We have changed the solutions that we're cleaning with so that they're bleach-based and appropriate for this type of virus. And then we've also installed barriers between all of our tables that are movable. So if you're in an area of the clinic that's not necessarily a table, we can move the barrier so that you have distance between you and another patient. And then our second question was, what in-home exercise support do you provide as far as what to do and how often, etc.? So we have a really, really fantastic home exercise program that works. It's a web-based program, and it actually, once you're signed into it and we create your program, then we are putting it in, and it's video form, video and pictures. And then it also has the sets and repetitions listed so that you're aware of when you're supposed to do them, how often, and how many. And then it does have a really great feature where if you do have questions about a specific exercise or what you're doing in general, it works like an instant messenger to your therapist, and they'll get those questions, and then you can get a quick response from your therapist regarding either the exercise, some progressions, or if you're having trouble with something. Somebody raised their hand, I see. If you can type the question, I'll be able to answer your question. And then we did have another question about wearing the masks in the clinic. So we've left it to our patients to wear their own mask. They're not required to wear surgical or the non-exposed mask. So everybody can use a face covering that is most comfortable for them, something that you can easily do things in, or we have options of having private treatment rooms where you can, do the activities in those rooms appropriately. The other option is a lot of our patients are utilizing that home exercise program where they're doing some of the newer things that need to be supervised by a therapist in the office, but then they're doing some of the things that they have more difficulty doing in the clinic with the mask, or because of, limitations, that they're able to do them at home and then kind of give us feedback on them.
Maybe worth noting that as well, we're also monitoring oxygen saturation very closely. So if you are wearing a mask and there's a concern about the ability to breathe and oxygen saturation, of course, it's important for us to monitor that. Especially because the nature of what we do may incorporate therapeutic exercise. So we do keep a close eye on that to make sure that that's appropriate as well.
Absolutely. I know there's another question, I just can't hear it. So if you were raising your hand, if you can either type your question.
Let's see. It was also, looks like there was a question typed in. Sometimes spinal stenosis makes my feet have less feeling. Is that something that we can help with? It does affect my balance when it is acting up, Nichole.
Yeah, so absolutely. And that's part of where we're talking about those musculoskeletal and those balance conditions overlapping, because if you have limited sensation because of the spinal stenosis, it's something that we have to first and foremost treat from that condition, and then work to either teach compensations or corrections to help reduce those limitations, or we teach some of the musculoskeletal condition exercises to help reduce those conditions in general. So it's kind of a two-factor treatment where we want to reduce the amount of limitation and sensation that you're having from the spinal stenosis, but then if you do have limitation, teach you how to reduce your risk of falling because of those limitations.
Looks like there's a follow-up question in chat. If I was going to another facility and stopped because of the situation, how easy is it to transition over to you with insurance, et cetera?
Yeah, so we have an on-site verification insurance team. So what the easiest way to do is give us a call. We'll take down the information. We participate with most insurance plans. So we're going to do a comprehensive verification to let you know if there is any out-of-pocket expense likely, and that'll all happen prior to your appointment. And then if you are having therapy in another facility and wanted to transfer over, that's more than fine. But also, we can work together with that facility if they've closed to kind of continue the program that you were on.
If I can add to that, Nichole, I
Sure.
just wanted to add on that question that we've always made it a point to try to, in every way we can, improve access to good care, physical therapy treatment with us. One of the other options that you have is to schedule online, and you can click the button that allows you to schedule online from our website, ProFysioNJ.com, and that will actually guide you through the same process. And some folks may find it a bit more convenient or just easier. You can actually take pictures of your insurance card with smartphones and tablets and things like that, and you can take care of that same process that way as well. Again, if you find it that it's easier to connect and more convenient for you.
Yep. Good. So we did have a question if somebody had raised their hand, so I'm going to allow them to ask their question.
Is it allowing you to turn the mic on or no?
It's the patient. Yeah.
Oh,
Or the, okay. Okay, so if you do have any specific questions or if you wanted to ask them privately, please reach out to our offices. Like Dr. Lenny mentioned, you can go online and schedule appointments, or you can request appointment times. The other thing, you can always have those complimentary consultations. So if you do have specific questions to your condition, then those are definitely the best ways to go about it. All of our doctors of physical therapy can answer those questions and can make you understand what your limitations might be, or you can give us some information and we can discuss if physical therapy would be correct, the right thing for you at this time.
wonderful. Please stay tuned for a future Zoom at Noon sessions. Our next one's going to be July 9th, and it's going to be about solutions to deal with arthritis-related pain. You can register for that Zoom at Noon seminar from our Facebook page by just going to Facebook and typing in ProFysioNJ.com. And also you can access videos like this one. Once it's recorded, we'll post it on our YouTube page. You can also find other video blogs that we've created and future seminars on our YouTube page by going to YouTube and simply searching, going into the search bar and searching ProFysio Physical Therapy should take you to our YouTube ProFysio page. Anything else you'd like to add, Nichole?
I think we were pretty much everything. If anybody has any follow-up questions, just let us know and we'll be more than happy to chat with any of you.
Wonderful. Thank you all for attending. It was our pleasure, and we hope to see you again at future presentations.
Thank you.